Hi, I'm Dr. John Martin. Today's video is going to be on a difficult subject of Polycystic Ovary Syndrome, or PCOS. Doctor. PCOS is a condition that affects over 200,000 women every year. It's kind of a complex problem because it's called Polycystic Ovary Syndrome, but it's really an endocrinologic metabolic syndrome that emanates from the ovaries. The most common symptoms are weight gain, irregular periods. The technical term for irregular periods is metrorrhagia, and that can be either missing months or just having extended lengths of periods. I did a video on periods, and I would encourage you to watch that. But these would be women who have over a 35-day cycle from the first day of one period to the first day of their next period. It often starts when women are young, going through adolescence, and then gets worse over time. But they have very irregular periods, usually represents they're not ovulating on a regular basis. They can also develop excessive hair growth. Hirsutism is the word that describes that. They can get central weight gain, acne, and even be at risk for type 2 diabetes. There's different terms for it. One is called Stein-Leventhal syndrome. That was actually how it was originally described by two physician scientists, and then it became polycystic ovary syndrome later. Some people call it metabolic syndrome or syndrome X, but to me those are larger endocrinologic syndromes, which can include heart disease and things like that. So I think the best term is polycystic ovary syndrome, or PCOS. Make sure that you have good discussions with your physician, because everybody kind of looks for this constellation of symptoms: the weight gain, the acne, the irregular periods, and then there's specific labs that I'll kind of go over with you. Some people have it worse than others. Some women struggle with weight, but they may not have all of the symptoms. All genes have what's called penetrance, meaning sometimes they'll affect somebody a little bit, sometimes they'll affect somebody a lot. So I've definitely seen thin polycystic ovary syndrome patients who only suffered from irregular periods or increased hair growth, and then I've seen women who struggle with weight. Either way, this is a metabolic syndrome that needs to be dealt with, and you need to discuss with your physician. So generally the first tip off is missing periods. It's actually unhealthy for your body to do that for a long time. It can put you at risk for developing something called hyperplasia, which is excessive tissue of the lining of your uterus, which even can lead to endometrial cancer. It doesn't happen quickly, but this accumulation of years and years of missing your periods can cause that to happen. Now, there's fairly common lab tests that are done to diagnose it. The history, to me, is the best way to diagnose this, kind of what you've gone through with struggle with weight gain, all of that. So typically the ratio is 2 to 3 to 1 of the FSH, the follicle stimulating hormone, versus the luteinizing hormone. If that ratio is 2 or 3 to 1, that can be diagnostic of polycystic ovary syndrome. One lab you can do as well as a testosterone level. Also, elevated fasting insulin levels, and then evidence of diabetes with a blood test called the hemoglobin A1C, which is a measure of your blood glucose over time. Lastly, on ultrasound, sometimes you'll find something where there'll be lots of little cysts or follicles in the ovary, and the descriptive one of polycystic ovary syndrome is what's called a string of pearls. So you'll literally see this string of little cysts all around the ovary, and that can be a clue that somebody has polycystic ovary syndrome. Again, everybody has different degrees of penetrance of these genes, so some people may have it worse than another. But either way, it needs to be addressed, especially if it manifests itself in the irregular periods. The irregular periods can represent that you're not ovulating regularly. So some women will have struggles with getting pregnant. You do not assume you'll have struggles because you do ovulate, but it's very irregular. But if you go a long period of time and you're not conceiving and you're having irregular periods, then you should talk to your physician about that. And that kind of leads me to what we do for treatment. There's really 3 treatment options for patients with polycystic ovary syndrome. One is put someone on a birth control pill or some form of birth control, because what it does, it suppresses the dysfunction from the ovaries. The weight gain is still a problem, but it allows you to address it. You have to be very meticulous about diet and exercise to get that weight off. It is harder for you to lose weight when you've been diagnosed with polycystic ovary syndrome. It will also improve acne, especially if you're put on one that specifically works for acne. You can have that discussion with your doctor. All of those labs, they can give us a good indication, same thing with the ultrasound, but it's really that diagnosis of persistently irregular periods, missing periods over time, that is the best way to make the diagnosis. Second option is to go on a medicine for diabetes, and believe it or not, because it does have this metabolic component, this medicine called metformin will often help women have regular periods. Obviously, it makes you ovulate, so if your intent is not to get pregnant, then you may want to go on the birth control pills plus the metformin, or just go on the metformin and use some other form of birth control, because it can get you ovulating when you have regular periods. And obviously, if your goal isn't to get pregnant, then you want to protect yourself from that. The third treatment option is actually trying to get pregnant. That's using a medicine for ovarian stimulation, because remember, a lot of this is these ovaries don't function normally, so they're not ovulating regularly, and therefore you get this constellation of symptoms. So if you get them ovulating regularly, you can return to having normal periods, and obviously it helps you get your desired pregnancy if that's what you want. The common medicines are letrozole and clomiphene citrate. Polycystic ovary syndrome is a difficult struggle that many women have, and it is a lifelong struggle. It does seem to get better as women grow older. There are some natural things. There's some articles published on taking myoinositol, some other supplements that will help you get regular periods. I feel that those are worth a try because they're not dangerous to you. I hope this video on polycystic ovary syndrome was helpful to you. If it is, please like it, share it. I will be posting other videos, and hopefully they are helpful and informative. Thank you very much. Be kind, be safe, and be well. Thank you.
Doctor, doctor, you gotta help.